Hello, I'm Dr. Rhonda Johnson, and today is Saturday, June the 8th, 2024. Today I'm talking about the health of African Americans during Jim Crow. Well, the subject of Jim Crow has been making the news recently, but just to refresh, Jim Crow laws started in the 1870s after slavery ended, and they lasted until the mid-1960s. This means that black people in the United States faced another 100 years of unfair treatment after 246 years of enslavement. Now, Jim Crow's laws made it legal to separate black people from white people in all parts of their lives, including health care. Now, these Jim Crow laws ended with the Civil Rights Act of 1964 and the Voting Rights Act of 1965, and that was about 60 years ago. So let's look at some examples of health status in the Jim Crow era. Well, during this time, black Americans were facing very poor health conditions. They were impoverished, they had malnutrition, and preventable diseases such as pneumonia, tuberculosis, and nutritional deficiencies were rampant. On average, in 1900, the average life expectancy for black people was 33 years, and that was 12 years less than the average life expectancy for white people at that time. Did you know that black people born between 1921 and 1945 under Jim Crow were 20% more likely to die early compared to those living in areas without these Jim Crow laws? The hospitals in the southern states were segregated, meaning black people went to hospitals that were often not as well equipped. Another example was unethical medical experiments. Black people were routinely subjected to unethical medical experimentation. For example, at Vanderbilt University from 1945 to 1947, black women were given radioactive iron without their knowledge to see how it affected their babies. Then there was the infamous Tuskegee syphilis study, where nearly 400 black men with syphilis were left untreated, even though penicillin was known to cure syphilis. And there was forced labor, which resulted in high death rates. Black people were often unfairly imprisoned. They were forced to work through convict leasing and dangerous jobs like building railroads, tunnels, and industrial mines. In states like Alabama, which leased prisoners to work for 55 years, it is estimated that 30,000 people died due to these harsh conditions. Now, I can't mention all of the horrors of Jim Crow, the lynchings, the mental health issues, the stress, the high rates of black infant mortality, the high rates of illiteracy, sexual assault, physical intimidation, black maternal mortality. Folks, I would have to make at least 50 videos to talk about that. So the legacy of Jim Crow still affects the health of black Americans today, folks, because many people who were born in that era are still alive today. So in closing, there was absolutely nothing that was good about the Jim Crow era for black Americans. And if I had to choose one word to sum it up, it would be deadly. That's my message today. Take care and be well.